Many patients ask, Doctor, my LFTs are normal, so my liver is healthy, right? This is a dangerous misconception. Today I'll show you how liver disease can exist even with normal LFTs. First, understand this clearly. LFTs don't directly measure liver health. They measure liver injury and liver function separately. ALT and AST measures liver cell injury. ALP and GGT measures bile duct involvement, and albumin and INR, these two measures liver function. ALT and AST rise only when liver cells are actively damaged. In chronic liver disease, damage is slow, so these enzymes may remain normal. Seen in fatty liver, chronic hepatitis B and C, and early cirrhosis. The most important thing to remember AST and ALT ratio. The AST-ALT ratio gives clues even when values are normal. If AST-ALT greater than 1, it indicates chronic liver disease. If AST-ALT greater than 2, it indicates alcoholic liver disease. This ratio often detects disease before enzymes rise. You know what is the most ignored test? GGT, yes. GGT is often ignored, but it is one of the earliest markers of liver stress. GGT rises in fatty liver, alcohol use, drug-induced liver injury, and cholestasis. ALT may be normal, but GGT rises first. So what about albumin and INR? Albumin and INR tell the truth. If albumin is low or INR is high, this means the liver is failing to perform its function even if ALT and AST are normal. This indicates advanced liver disease, cirrhosis. Always remember this rule. Normal ALT isn't equal to healthy liver. Enzymes show injury, not function. GGT, AST-ALT ratio, albumin, INR reveal hidden disease. These are the main culprits. Never read LFTs in isolation. Thanks for watching.